Hello everyone, welcome to the another episode of Ask Giri the Physio Show. This is season 5 and episode 6, the last one of the year. Usually I do much more episodes in a year. This year has been very tough with a lot of busy schedules and a lot of other things, a lot of fires to put off in all the clinics. So I did very less episodes this year. But I promise you that I will catch up next year with much more episodes and knowledge transition and education and empowerment for you. And also, I'm very excited to let you know our Forever Fit podcast is going to start next year as well. Our first episode is come on February because I'm taking a month off in Jan to travel to play some cricket in Singapore, Malaysia and Thailand. I'll be back fully energized. What's a better way to start a new year other than taking a vacation, right? So I'll be back in full strength and energy for you guys in February. And we're going to launch our first episode of Forever Fit podcast and much more episodes of Ask Giri the Physio Show. If you haven't subscribed, please visit physioshow.ca and look at all the episodes and go to our YouTube channel Ask Giri the Physio Show and like and subscribe and share with your friends. You know, knowledge is only powerful when it's shared. So what are we going to talk about today in Ask Giri the Physio Show? Today's topic is whiplash. Because it's that time of the year, a lot of motor vehicle accidents, a lot of people getting hurt in sports and also motor vehicle accidents. Whiplash injury, which is that injury to the spine, especially the neck, is very common. So we're going to today talk about the topic, whiplash injury risk classification and treatment approaches. It is very research based because we love when the research kind of helps us in rehabilitation. So today's episode, we're going to talk about Whiplash Risk Stratification Tool. This is a joint initiative. It's developed by Recover. Recover is a joint initiative of the Motor Accident Insurance Commission and the University of Queensland in Australia. So we will be using this tool to identify people who had whiplash, who is at low risk, who is at medium risk, who is at high risk. And why that is important for a physician or a physiotherapist or the insurance company to know. So we can have different approaches for the people with low risk and medium risk and high risk. So this tool helps us to classify the whiplash injury patients into 3 different risk categories so that we can develop a nice individualized treatment plan for your recovery from the whiplash injury. Recovery following a whiplash injury is very varied among all individuals, right? 50% of the individuals, they recover pretty good, fully recover, no problem. They go back to work, life and sports and everything. 25% experience milder levels of disability. This is kind of the normal outcomes in here. A risk stratification tool like this one is a research-generated tool used to predict outcomes such as likelihood of developing moderate and severe disability or experiencing full recovery from acute whiplash injury. So these studies, we observed mainly increased probability of developing chronic, moderate or severe disability in the presence of older age and initial higher levels of neck disability index and hyperarousal symptoms. It's basically an outcome measure where patients would fill out. It has a lot of questions in it. You fill out, say, how is your neck doing when you're doing different things? And we'll get a score out of that. That is your neck disability index. Then there is another small 5 to 6 questionnaire for hyperarousal symptoms to see how you feel about the recovery, the body after the whiplash injury. We get the scores from this, and based on your age and this scores, we will classify into low risk, medium risk and high risk. So what does the risk classification means for treatment? Why it is important we have to classify the risk and into low and medium and high? Because it's very important, because these low risk people will need minimal intervention, right? Very minimal intervention comprising of a lot of patient neuroscience, pain neuroscience educations, patient education about ergonomics, about postural control, about loading, how much loading can spine take, and also graded exposure and simple exercises. The low risk people, that's all they need. Good education, simple exercise, a little bit on hands-on if needed. So we know that's the kind of approach we need, right? And the patients who are classified under medium risk or high risk require further assessment of their movement, muscle control and kinesthetic awareness, sensory examination, and also psychological factors such as like recovery expectations and post-traumatic stress symptoms. Some people experience that. We definitely refer them to psychologists and kind of do some psychological help as well. And also treatment will depend on findings from that more detailed assessment. So that is why it's very important for us to classify the risk so that we can give appropriate treatment for these people. If you want to know more about the Whiplash Risk Stratification Tool, it's available on the recover.center.uq, which is for University of Queensland, .edu.au. So I'll put the link in the bottom so you can check it out. And also, when we classify the risk, when we go into the treatment, we follow the current evidence-based clinical practice guidelines for acute whiplash in our clinics so that you get the evidence-based treatment and get better on your road to recovery. It's very, very important for you to get better, and you know that you have help out there, and get better and get on with your life and work and sports, whatever you need to be. You don't have to worry about, oh, I got a whiplash car accident, what's going to happen, my life is ruined. You don't have to go into that. This whiplash can be managed very well with a good team, at the good clinic, and good evidence and good support for you and your family. So how do we use this tool in our practice? Basically, when you come in, we have to fill out some paperwork for you, right? So this is called the Neck Disability Index. We let you to fill out this, and we make sure what kind of score you're getting it. Then we're going to let you fill out the hyperarousal symptom questionnaire, and you're going to see what score you're going to get it. If your Neck Disability Index score is less than 35 and your age is less than 36, then you're low risk. So if it is more than that, and then also your hyperarousal symptoms is also less than 6, then you are at high risk. So we put these numbers together and kind of clinically classify you as low risk, medium risk, or high risk. Then based on that, we develop treatment approaches for your recovery. So that's why these kind of research-backed tools are very important for a clinician like me to treat your whiplash injury. Now we know if you get a car accident and whiplash injury, and there is a way to identify your risk level and also giving you appropriate treatment approaches. Okay? So if you like this episode, share it with your friends, anybody who needs it, and also subscribe our YouTube channel. And I wish you a very, very happy holidays, Merry Christmas, and Happy New Year for all my audience who are watching this. And then have a wonderful, wonderful New Year. And in 2025, I promise you to coming back with a lot of information for you to help you in your health journey. To educate and empower is my passion, and that's why we are doing this. Take care. Bye.